Endotracheal suctioning is the process of inserting a suction catheter directly into the endotracheal tube of a patient who is receiving mechanical ventilation. There are a few specific details about this type of suctioning that you must be familiar with, which is why in this video we're going to break down a sample TMC practice question on this topic. So, if you're ready, let's get into the question. A 70-year-old male patient is intubated and receiving mechanical ventilation in the volume-controlled assist control mode. After performing endotracheal suctioning, which of the following would indicate the effective clearance of retained secretions? A. An increased tidal volume. B. A decreased inspiratory time. C. A decreased plateau pressure. Or D. A decreased peak pressure. Do you know the answer? Well, let's break it down. In general, you should remember that retained secretions will increase the patient's airway resistance and peak airway pressure during volume-controlled ventilation. So taking that into consideration, if you were to decrease the secretions via suctioning, that should decrease the patient's peak airway pressure. On the other hand, if the patient had been receiving pressure-controlled ventilation, you would expect an increase in delivered volume once the secretions were cleared. That is the key tidbit that you needed to recognize in order to answer this question correctly. In other words, you needed to understand the difference between volume and pressure-controlled ventilation. If you were able to do that, then you could easily determine that the correct answer is D, a decreased peak pressure. If you enjoy practice questions like this, definitely consider checking out our TMC test bank. It's a massive bank of practice questions with helpful explanations like this one that students are using to pass the TMC exam. It also comes with 4+ sample TMC practice exams to help you test your knowledge and prepare for the real thing. If you're interested, I'll drop a link below this video if you want to learn more, including some helpful premium bonuses that are only included for a limited time. But if you want to support the channel, please like and subscribe. I would greatly appreciate it. And there should be some other helpful videos popping up on your screen right about now that I think you will enjoy. And just a quick reminder, we are not doctors. This video is for informational purposes only. Thank you so much for watching. Have a blessed day. And as always, breathe easy, my friend.